happy I'm gonna be your nurse today. How you feeling? Can you tell me your name and date of birth? So we're saying he's confused. And she might say, my name is Sally Hanson. Okay? What are you supposed to do as a nurse? So you have two patient identifiers. You ask for the name and date of birth. What are you supposed to do? Even though you have a computer and it says a name and date of birth, and they might be saying something, what do you check?
The wristband.
The armband. So the armband says Annie Trahan. Okay? So you have to check that armband. So that's your two patient identifiers. Do not administer if you did not draw it up or prepare it yourself. This is a rule that I want you to live by from today to the end of time. If you didn't draw it up and you didn't prepare it, you do not give it. I don't care if it's your best friend who's a nurse that works with you on the same shift. Even if it looks like the medicine you're supposed to give, the rule is, if you do not prepare it, you do not give it. Minimize verbal or telephone orders. Repeat the order to the prescriber. So you're in a room and the physician says, Benadryl 50 milligrams now. Okay? Now, you're gonna say, okay, doc, so you want me to give Benadryl 50 milligrams right now? What's missing from that?
How do you want to give it?
How you want to give it, correct. So you need a route. So you have to confirm, okay, doc, do you want me to do that IV push or you want me to give it by mouth? So exactly. So you always want to repeat the order to the physician and making sure you have all parts of that order. And was that a one-time order or is that a continuing order? Spell the drug name aloud. If in doubt, spell it out loud. Speak slowly and clearly and list indications next to each order. Never assume anything about items not specified in your drug order. Never assume a route. Some things are only given by IV. Okay? Some things are only given by mouth. Some things are meant to give rectally. Always ask and clarify the route. If something was meant to be given by mouth and you push it IV, it was meant to be given a different route, and you do it IV. What could happen?
They get the wrong concentration.
The dosage, because isn't IV stronger than?
Correct. Correct. We talked about that in another lecture.
Mm-hmm.
They could be getting the wrong. It's too strong, right? Because if you give it by mouth, it's going to go through the GI tract, and it's going to be digested, and you have hydrochloric acid, and you have other stuff, so you won't get the full strength of the dose.
Mm-hmm.
But if you give it IV, do you get the full strength of the dose?
Mm-hmm.
And immediately,
Mm-hmm.
right? So you have to make sure you get that. Do not hesitate to question a medication order for any reason when in doubt. Guys, it doesn't matter if that's the meanest doctor at that hospital. And you have to pick up the phone and question, hey, I just want you to clarify, did you mean this? That's fine. Remember, you're a patient advocate, okay? Do not try to decipher illegible written orders or contact the prescriber for clarification. Always, when in doubt, call and ask, okay? You are saving lives. You're out there to help the patient. And always remember, I'm a patient advocate. And if you have to hear Ms. Naquin saying that in your head, it's happening to you, and you have to go back to that doctor, remember Ms. Naquin said, you're a patient advocate. So call the physician and ask. Do not use unapproved abbreviations. Okay, remember when Ms. Adams, when we listened to her teaching the math, what did she say about units?
Write it out. Write the word out.
Write the word out. What about every day? What other things we think we have to write out?
Every other day.
Okay. Well, was anything said about morphine or mag sulfate?
Write out the word.
You have to write out the words. Correct. Good job. Never use a trailing zero with medication orders. Never. Do not use 1.0 milligrams. Use 1 milligram. Why? Because 1.0 milligrams could be misread as 10 milligrams. Is that a problem?
Yeah.
That's a huge problem, resulting in a 10-fold dose increase. You have to see how that could happen.
Mm-hmm.
Absolutely. Always, always, always. Miss Adams said this on the videos, the math videos, and y'all make sure y'all re-listen to those videos before the test. Always use a leading zero for decimal dosages. Do not use 0.25 milligrams. Use 0.25 because the decimal, it may be misread as 25 milligrams. Yeah, see how that could easily happen. Okay. Take the time to learn special administration techniques of certain dosage forms. Always verify new medication administration records. Read labels and use generic names to avoid sounding like trade. Questions about that? Always listen to and honor any concerns expressed by the patient regarding medicines. Okay, so I have my pills and I'm going to my patient. And you know what patients do sometimes? Sometimes they will say, so you're going over the medicines that you've given the patient, and they will say, well, I know the white one is gonna make me make water, and the pink one's gonna drop my blood pressure, and the blue one is going to thin my blood. Okay, is there a problem with that?
Yeah.
You think? What could be a problem with that?
Another drug could be the same color.
Exactly. Another drug could be the same color. Or sometimes, this is a big one too. So they might be prescribed 5 milligrams, but the hospital only carries it in 10 milligrams. 5 milligrams may be blue, 10 milligrams may be pink. You just cutting the pill in half and giving them their correct dose, but it's a different color. So although patients don't know their drugs by names, they know them by color. Some people do, and that's okay. You would just have to make sure that you go through every single one by name and you tell them what it's for. Okay? Did I get that clear? Was that clear? Okay. Always, and ask them, hey y'all, if they don't want to take that stool softener, because they've gone too many times, but it's still ordered by the physician to give it, if they refuse it, do you force it?
No.
You can educate and say, the physician ordered it, if you want it, it's ordered, but if they don't want it because they might have went to the bathroom 5 times, you don't force them. Check patients' allergies and identification. Okay, hey, they might be allergic to penicillin. This is huge, okay? How many medications have penicillin in it? A lot. Clarify, because sometimes, let me say this, sometimes it's still prescribed because their reaction is not an adverse event, or it's not a true allergy, okay? So, they might just say, I might just break out with a small rash, or I might just itch for a little while. So the physician may look at it as, for the better good, he's gonna still prescribe that medicine. You see what I'm saying? So you always have to investigate, what is your allergic reaction? Exactly. Patient might say, I have anaphylactic shock. My throat closes and I can't breathe. Well, at that point, are you gonna give that medicine? No. Will you call the physician?
Yes.
Absolutely. Know where to find information on medicines. Okay, remember we talked about on the computer, when they have the drug name, you can right click and it'll pull up the Davis Drug Guide, right? Know where to find preparation, side effects, use only current sources. Wikipedia, is that current? Is that a good place to look up stuff? No. You go to your Davis Drug Guide book, you look up current stuff, journals. If you wanna look up like antihypertensive, you can go to journals. If you wanna look up chemo drugs, you can go to journals, but journals are better places to go. Mandatory second nurse verification for high-risk medications in our patient population. Okay, nurses are famous for this. Insulin. Insulin's huge. You need 2 nurses' signatures for insulin. Everybody's busy. We get it. Okay, you're the Omnicell. Remember we talked about the Omnicell. And I'm pulling up my insulin, right? And I say, Nancy nurse, I need you to come sign for my insulin. My blood sugar was 280, I'm giving 4 units. I'm telling her. She's putting in her stuff and she's signing, but her putting in her name and her password, it counts that as she's signing off with me that she saw. What happens though when that nurse walks away?
You could do something different.
Exactly. What if I decide I wanna be a mean girl and I wanna pull up more, or that day I wanna be malicious and I wanna pull up more and go give the patient more, right? I could pull up a wrong dose. I could pull up a wrong dose by accident and not even mean to pull up a wrong dose, okay? So Nancy nurse should have done what? Stayed and watched and pulled it up and verified on the syringe. And eyeball the syringe and get that dose, right? That's what you do. You busy, just take a couple seconds to eyeball that, cause your name is on that. And you know how hard for you it was to get your nursing license, right? And it could take a split second to something to happen, and you might lose your life. You know, you don't want that to happen, but you follow up and you eyeball that syringe. And I mean that for like high narcotic medications, like you always gotta sign off. If somebody has to give half a dose of something and they gotta shoot it out in the sink, you watch, okay? Yes?
Epic now makes you, when you're actually scanning the patient and scanning the insulin and you're signing off on it after you've scanned the patient, scan the insulin, they make the other nurse sign in the charting system.
Awesome.
So it's a double sign off.
Awesome.
So that prevents Nancy nurse from not seeing that syringe,
That is awesome.
because you have to be in the room with the scanner,
And,
with the chart, signing off a
and
second
guys,
time.
you're not undermining anybody by looking at that. Like, you're not. Like, honestly, you're not. Like, I could be thinking about, oh, my daughter's having wisdom teeth surgery on Friday, and I'm worried about that because the doctor says it's gonna be hard to take out those teeth. She's this big, and my mind could be on that. And I'm pulling up, and I'm not focused and pay in the moment, and I pull up more, okay? And that Nancy nurse says, oh, Beck, that's only 9. You meant to pull up 11, or whatever, you know? Oh, my bad.
We usually tell people, raise your hand if you're not human. Humans make mistakes, last I checked. Even the best ones.
Absolutely.
Don't think it can't happen.
Minimize interruptions when preparing and delivering medications. Guys, this is huge. When I was teaching at Nichols, I did a presentation on that. Some hospitals implemented, and I haven't seen it around here, and it's in other states, but there's a vest that you put on while you're giving meds, and it says, do not disturb. And that way people know, and you're giving medicines, because it takes a split second for them to draw your attention away, and you forgot whether you pulled it or you didn't pull it, or you pulled a different medicine out of a different cubby, right? A split second. So some hospitals have implemented a vest or a shirt or something that the nurse puts on to alert. Leave me alone and give it, and it could be a color. It could be red. It could be green. Do not talk to me. I'm good, like, then take the vest off and then, you know. But everybody in the hospital knows she's doing meds. It could wait. Okay, question. Take your best shot, take your best guess. The nurse is administering a drug that has been ordered as the following. Give 10 milligrams on odd number days and 5 milligrams on even number days. When the date changes from May 31st to June 1st, what should the nurse do? Is it A, give 10 milligrams because June 1st is an odd number day? Is it B, hold the dose until the next odd number day? C, change your order to read, give 10 milligrams on even number days and 5 milligrams on odd number days? Or D, consult the prescriber to verify that the dose should be alternated each day no matter whether the day is odd or even? answer?
Yes.
All right, everybody says D? D, yay! Although option C seems reasonable, but the nurse does not have prescriptive authority to change the order. Therefore, the prescriber should be consulted to verify the order, which can be written in clearer terms. The other options would result in a change in the alternating dose schedule. Good job, I'm impressed. Reporting medication